My buddy says peptides changed his life. Should I believe him?
Well, I would ask him which peptides specifically he's taking. Changes in your physiology, your metabolism, definitely can be life-changing. There are a lot of peptides that have very valuable activities, from increasing growth hormone production, which I call your master hormone, the icing on the cake, if you will. There are not any peptides currently that increase testosterone, so that's still something that you need to make sure does not need to be addressed, but there are peptides that help with muscle metabolism. I like one called MOTS-c, helps increase metabolism, energy, and muscle metabolism specifically. A lot of people that are sore all the time. Well, why are we sore? That's often because you don't have adequate testosterone, so inflammation runs rampant. But BPC 157 with TB500, nicknamed Wolverine, is a great one. Another one just for longevity and aging is Glow, which is BPC 157, TB500, and GHKCU copper peptide, can help give you really that glow, that look of vitality from having better skin, hair, and nails. And then Klow, KLOW, is a combination of those three plus KPV, another very anti-inflammatory peptide. And so there are a number of things that we can take that, if you sore a lot and you have no more inflammation, that's amazing. I have people with joint pain, knees, hips, shoulders, wrists, that peptides have impacted and they're much more active. And so, sure, they're happy. And so, I just like to try to identify when someone says, hey, I feel great, you got to take peptides. Well, okay, what are you taking? Why? And let's see how that may be effective in my life. And again, I think it's seeing an expert, getting some baseline studies done to see, well, is that something else? I think peptides alone aren't the answer to everything. I think that, they're really valuable. I've been certified in peptide therapy for 7 or 8 years, long before it was the buzzword. We were talking about it and using it in selected patients. And, there's just a lot. Some people just never sleep well. I like DSIP, Delta Sleep Inducing Peptide. That's one that can help a lot. I'd rather see someone take that than Ambien or Restoril or a narcotic that's going to knock them out and give them a hangover the next day. So, there are many different compounds that we use and things that are constantly being looked at and developed to help us have even more options for helping people to feel their best.
Can peptides actually help me recover faster after workout?
Well, absolutely. I think the top one, Wolverine or BPC 157 and TB500, is proven many times over to help decrease that inflammation. A lot of guys that use it right before a workout, so they're not as sore after or as soon as they get home. I'm not sure it matters exactly on the timing, but it works very well. And so some people with generalized arthritis just feel better from using it daily, early in the morning. Sometimes some like to use it or prefer to use it at bedtime. But there's no question that it helps reduce levels of inflammation and has a lot of implications for long-term health.
Can peptides help build muscle, or is that mostly hype?
Well, certain peptides can help. I think things like AOD 9064 and MOTS-c can help with muscle building. But if you don't have adequate testosterone, you're never going to adequately build muscle. And so you still need to look at those levels. Certainly sermorelin, tesamorelin with ipamorelin can help improve growth hormone levels. And having optimal growth hormone levels is definitely associated with better muscle metabolism, feeling stronger, having less inflammation. developing more muscle, losing body fat, improving collagen, lines and wrinkles tend to improve. So, yeah, from that perspective, yes, those peptides can help with muscle building.
Can peptides help prevent injuries or speed up healing after an injury?
Well, I don't think peptides are going to prevent an injury. Good flexibility and good strength and conditioning is what you do to prevent injury. Can it speed up or accelerate healing from an injury? Yes, for sure. And so it seems that, yeah, those are the people that usually reach out and try it first. You know, my knee's still sore, my shoulder, something's going on. I want to feel better so I can get back in my activities. And so that is when I think we would see sometimes the best results with peptides is when we're recovering from an injury.
How can you know that a peptide clinic is legitimate?
Well, again, I think you need to search for a provider. I don't trust many online sources. I think using an established, certified, inspected compounding pharmacy is very important. I do work with a company that does online peptide cells that is very reputable, that has a telemedicine link with and doctors that screen all of the participants. And so you can message me and I'm happy to share that with you on how you can access that. If you don't have an expert in your area that you can go talk to, you can go in and technically, select the peptides you read about or you're interested in, and then fill out a questionnaire, and their telemedicine physician will get back with you. And if they have further questions, they'll actually contact you. So I'm happy to talk about that and share that information. You could just go on, contact our office or our website at aspen-regenerativemedicine.com. Call us 970-201-1332, and we can help you to access that information.
Are peptides something you take forever, or are they meant to be temporary?
Well, you can use peptides long-term. There are some, if we're trying to stimulate growth hormone production, we don't always do it every day. It's age dependent. The older you are, the greater need you'll have to use it more often. We like to do a break, maybe 5 days on, 2 days off, or use it for a month or two and then give it a break for a week or two. There's really no one exact way. It depends. The younger you are, the more breaks I think you could take. As we get older, we're not going to make it anyway. And so you use it when you need it. And whether it's a nightly sub-Q injection of something to stimulate growth hormone or something you're taking daily to help with inflammation levels. We didn't even talk about peptides that can stimulate immune function. There are several that, are very useful in helping to improve overall sense of well-being and health.
Peptides that can stimulate the immune system.
Well, I do think that there would be an indication place for things that improve immune function, like thymosin alpha-1, with long COVID, with any persistent viral infection, autoimmune disease, those things for sure. I don't use a lot because I fortunately enjoy good health and I'm not sick very often. But I do think that there are cases when it would be a really smart thing to do, particularly if you suffered from a vaccine injury or long COVID, viral illness that's lingering, hanging on for sure. If you're interested, you can simply go to our website, shoot us an email, give us your contact information, set up a telemedicine or phone consult. We can talk about the options of different peptides. As I said, if you want to do kind of self-direct some of the care yourself, then I can share the site with you for the company that I advise and work with that does online telemedicine peptides, and or we'll take care of it for you. You can call the office, 970-201-1332. Check out Instagram, Dr. Julian Gershon, Facebook, Aspen Institute for Anti-Aging and Regenerative Medicine, or the website.